75 degrees, Randy remembers that. 7:15 is our time, and some big news at St. Louis University. They discovered treatment for a rare genetic liver disease. It's called ATT deficiency, which can cause severe lung disease from the liver to the lung. And Dr. Jeffrey Teckman, he's a researcher. He's on top of this. He joins us with how this drug is a game changer. Good morning, doctor.
Morning, John. Thanks for having me.
Let's just talk about basics for example. Now, ATT is a protein. We all have it. It's made in the liver, passes through the blood, but some people have a deficiency, and that's what this drug is used for, to help those people, correct?
Right. Alpha antitrypsin is made in huge quantities in your liver and released into the blood. And it's supposed to help defend your body when your body's fighting infections, but some people inherit an abnormal gene for it, and their liver makes an abnormal kind, and that abnormal protein builds up in the liver and can damage the liver, and the lack of the normal protein can damage your lungs. It affects about 1 in 3,500 Americans, which is not common, but it's really not that rare.
So what was the prognosis for people, one of these babies born with this deficiency before this drug came around?
Well, the liver damage can affect infants and children as well as adults. There's been no treatment except the liver transplant when the liver completely fails up until now. And this is the first, what we call phase 2 trial. It's the culmination of more than a decade of work from my laboratory at St. Louis U, as well as many other people around the world, in cooperation with a couple of pharmaceutical companies, Arrowhead Pharmaceuticals and Takeda, where we have shown the effectiveness of a new drug, fazirsiran, and it blocks the production of the bad alpha antitrypsin from the liver, so the liver does not get damaged. And a number of patients in this trial surprisingly improved, even more than we expected.
Were you surprised at that? You were involved in this research, I know. And would you consider this to be a game changer for these people?
Oh, absolutely. Before now, there was no opportunity for treatment except for a liver transplant at the very end of the disease. And this has really shown that we can not only stop the progression, but half the patients in this early study, actually their liver improved. I used to be taught many years ago that scar tissue in the liver could never go backwards, that once you had it, it was always there in alpha antitrypsin deficiency. But half the people in this very short study of 6 to 12 months, the scar tissue in the liver actually regressed, or part of it went away, which was really amazing and unexpected. So the next step is going to be a much larger international study to really nail down the dosage and exactly how to give and who is really going to benefit from this study. But it looks like children as well as adults are going to benefit all over the world. So
you need more people with ATT deficiency to participate in this next study?
That's right. This was a phase 2 study, which shows the evidence of benefit. And now we need patients from all over the world to participate in what's called a phase 3 study, which will show data to the FDA to allow a full approval of the drug.
And where should they contact you? At St. Louis University?
Absolutely, yes, St. Louis University. They can also, if people live outside St. Louis, there will be other sites around the world. But yes, and many other trials will be coming online, but this is a real game changer and something very unexpected for this community, which really has had decades of no treatment for the liver except a transplant.
I get chills just hearing some of these stories, Dr. Teckman, because it can help so many people. And we have so many brilliant people living here in St. Louis. You are one of them. Thank you, sir, for joining us.
I appreciate it. Thanks for your time.
Our pleasure. We're going to take a little break. We'll be back with more Fox 2 News in the morning at 7 right after this.